The program is basically this. We are established to try and serve target communities, which are the underserved and underrepresented communities of the United States. And we're starting in California. As you know, the underserved and underrepresented communities are severely burdened by poor health and by excess burdens of illness, many of which are preventable. And we feel very strongly that this is where we wish to target our work. To do that, we have worked with a number of different organizations like Mi Mentor, where there are students who are interested in healthcare and in general, or medicine in particular, who want to go on and complete a higher level of graduate work after their undergraduate degrees. We call that the pipeline. There are multiple pipelines. The largest actually is the California State University system, with whom we have a formal understanding and a program that we're rolling out as we speak in the campuses of the CSUs, the 23 campuses. We are also working with the University of La Verne. You heard that name come up a couple of times, where Dr. Williams was. And we have a close working relationship with them. We have pipelines also with the what we call the safety net healthcare systems around California, the California Primary Care Association. And the purpose of that is also to get recommendations for people who are employed who may want to take their skills to another level. And so they come with recommendations from their employers. What we do is put people through the first phase, which is called the Gateway Master Program. We call it the Gateway because it's a gateway to two things: either medical school or higher medical training, like a dentistry or advanced nursing, et cetera, or PA training, or it is a gateway to employment in healthcare. The master's degree prepares you with a Master's of Science in Community Medicine, which is another way of saying it trains you as an advanced community medicine clinician to work effectively in the communities, the target communities that we mentioned earlier, to be able to improve health and lower the burdens of illness through prevention, and also work upstream in the social determinants of health that contribute so much to the health burdens that these communities bear. From the master's program, you either go into medicine, as I said, or other advanced training, or into employment, and then on to graduate medical education. That means residencies, basically, and specialties after medical school, and then go back, hopefully, into the target communities and nominate other people that you identify who are qualified to come back through this process. So it's a reinforcing circle. Next slide, please. The Gateway Master of Science in Community Medicine is really attempting to deal with health equity, which is the highest level of health for all people. As you know, the disproportionate burdens of illness and poor health are unequally spread across the country in communities that are underserved and underrepresented. And it's the culprit behind why the United States spends so much on healthcare, but continues to lag behind in health outcomes. Next slide, please. Our mission is simply stated: to prepare skilled physicians and health professionals from underserved and underrepresented communities, to partner with those communities to improve health, lower the burdens of illness, and reduce the need for medical care. Next slide, please. I apologize for the phone in the back. It's a robocall, probably. Now, the curriculum structure for what we do is this. This program, the Masters of Science in Community Medicine, is a 2-year program, 54 credits, and it is designed, as I said, to prepare you either for employment or further health professions education and medical, including medical school. It is a 2-year program, and it consists of two kinds of teaching, two kinds of learning opportunities. One are synchronous in-class learning, and the second are in-community assignments. And we'll talk a little more detail about each. Next, please. This is a map of the curriculum, and Dr. Levitin can answer any questions you might have about that. She's the architect of this map for us. But in what you see is the first year is 30 credits, the second year 24. The 30 credits in the first year are divided into first and second 2 semesters. The first, and when you see a course numbered F1, F2, F3 at the top there in the first year, those are what we call foundational courses. The first is in community medicine and social determinants of health, in which the first year we're focused on infectious diseases, the second year on chronic diseases. The second major foundational course is health system sciences, with a focus on process improvement opportunities in the second semester on implementing process improvement and quality improvement activities. The third foundational course, which is really driven to ensure that students enrolled in our program succeed. We enroll students, we ask a lot of our students, but we also want you to succeed. And so we have what we call a strategies for professional success, which is really teaching learning skills, study skills, communication skills, and problem solving skills, both as a class, but also individually with individual support and tutorials for those who wish it or who might need it to deal with a particular area that they may be stumbling a little bit with. We also have the capstone, which is required of all students. It's a community-based service learning experience. It's 6 credits, and it involves working in a community setting, or actually a community where a setting is that you choose. We can help you find one. We can help you select it. We can pick one for you if you can't do it. But every student is expected to have a community site for their capstone experience. And we'll talk a little bit more about what we'll do in each of these in the capstone, both in the first and second year. Then we have 2 additional tracks, and those who are going into medicine or have not had in-depth training in the basic sciences will undertake or choose to go through what we call the Introduction to Life Sciences, which is really just what it says. It's designed to prepare you in the basic sciences that you will need for medical school, and it will also prepare you for the MCATs. So this is really our answer to the fact that in terms of requirements to get into our program, they're fairly broad, deliberately so. 2.8 GPA, no prerequisites, no prescribed major, and no standardized test requirements. We want to cast a large net and encourage a wide range of people to come into the program. And then we want to make sure that we help you succeed in whichever of these 2 tracks you want to go into, either employment or into medical school or advanced dentistry, others that have similar requirements. The second track is what we call community medicine interventions, and these are for the people who are going out to employment after graduating from our program. And we have 2 courses. One is called Nutrition and Health. The second is called Precision Health and the Future of Community Medicine. In the second year, we have 2 foundational courses, continuing this idea of these courses running for an entire, 2 semesters, Direct to Community Healthcare, and something called Motivation, Change, and Leadership in the context of both a healthcare system in which you might work and also in the community. And then you have the capstone, which is basically carrying out a health improvement intervention. Now we'll talk a little more detail about that, but this is the broad map of the program. Next slide, please. The first year curriculum is, as I mentioned, 30 credits and has these courses. This just summarizes the same, I think, went through. Next slide, please. And the same for year 2, 24 credits, foundational courses, and then the capstone. Next slide, please. The overarching themes of the curriculum are these. First of all, we talk about the basic sciences of community medicine. We give you a deep grounding in what we call these basic sciences. The science of health and illness prevention, the science of quantitative analysis, of health systems management and leadership, of innovation, of behavior and motivation, and also the science of the determinants of health, the so-called social determinants of health, policy and law, racism, inequality, and lifestyle contributors to health status. Next slide, please. All the courses, including the capstones, work on the development of your personal capabilities in these critical 7 areas. We have 4 habits of mind: critical thinking skills, effective communication skills, creative thinking capabilities, and effective interactions with others, ability to work effectively with people who are on your team, people in the community, etc. And the second are what we call habits of heart, which have to do with decency, the issue of empathy and ethics, honesty, transparency, resilience, the ability to rebound, if you will, from setbacks, from difficult times, from emotional problems, whatever it is, the ability to continue scrambling to do the kinds of things that you need to do in a community setting. And finally, maturity, the ability to bounce back, to maintain a certain objectivity about what's going on and develop an understanding about what's going on, to keep yourself on a more even keel in terms of dealing with life's ups and downs, both in your personal life and also, frankly, in working in a community setting in community medicine, which is awfully difficult work. It's very challenging work, as you probably know. Next slide, please. The Community Medicine and Social Determinants of Health first program, the foundational one, really talks about to understand health in any community, the student learns to explore several basic questions. And we really mean this. You explore these questions. There are no specific answers, but you learn how to think. You learn how to attack a problem like this, how to think your way through an issue like this. Like, what are the major healthcare problems? How do you know? Why are they happening? How good are the data that you have to justify this? How reliable are the data? And what resources exist in communities to help respond? How do you prevent it? How do you reduce their impact? It's looking at a variety of illnesses, acute diseases, infectious diseases, and chronic diseases, but asking these questions about it. So instead of memorizing, 5 different families of infectious agents, we want you to ask, why are there 5 different families? What other ways can you categorize them that might be useful for community medicine? We want you to think your way through the whole issue of how we talk about and how we measure and how we quantify community medicine and the social determinants of health. Next slide, please. In the health system sciences, we really teach you to understand, develop, and manage budgets, which are, as we always like to say, that's the fuel of any system you're in, is how it's paid, how you get paid, how people are paid, what you allocate funds to, et cetera. We also teach you to organize and implement projects. A very complex issue of project management. It's quite a skill. We teach you continuous quality improvement, which is the science of quality improvement, which sits at the heart of how you take a project, an issue, a care delivery capability, a program, how you decide to measure it, and how you consistently improve it over time once it's established. Next slide. The strategies for professional success I mentioned earlier, it's trust building and ethics. How do you do that with your peers, with the people you're working with in the community? Communications effectiveness, both oral and written. And finally, learning. How do you learn? How do you organize your work so that you can become an effective student in the demanding setting, for example, of a medical school or a dental school, or even in the community where you need all sorts of ways of gathering information and learning? How do you go about that? What are the strategies you employ for yourself to become effective at that? Next slide, please. The direct-to-community healthcare, which is a second-year program, this is really all about, I'm not going to go into great detail here, but I'd be glad to answer questions. Basically, what we're doing here is helping you understand how a community can be helped with technology and the emerging sciences without relying on the medical care system, without relying on doctors and hospitals and emergency rooms. What can we bring directly to consumers, to families, to communities to help them raise the level of their health and lower their burdens of preventable illness, for example? And let me give you an example. If you have type 2 adult onset diabetes, you'll go to the doctor maybe 4 times in a year for 15 minutes each time, right? That's an hour a year. The rest of the time you're on your own with your family, taking care of your diabetes. Now, how do you do that? What do you have to do? How do you learn to do it? How do you learn about your food, about exercise, about managing stress, about sleep, about the symptoms you need to watch and follow? How do you get your questions answered if you have questions about that? There are now over 1,000 cell phone apps for helping you manage diabetes. That's an example of what we're talking about here. There are many issues, and you see them on the slide, of what we'll be talking about in that course. But it's a critically important course for the future of community medicine. Getting more things into the hands of communities and families and individuals that will help them manage their own care without having to rely on a medical care system that won't always be there for them. Next slide. Then, of course, the last of the foundational courses deals with how you motivate people, how you organize and direct and lead change, or how you manage change in an organization or in a community, and how do you exercise leadership and followership, by the way. We will deal with both. All of these issues, motivation, change, and leadership, have to do with given the fact that you are a professional in community medicine, how do you engage a community? How do you engage a healthcare system? How do you engage your peers in addressing changes that may need to be made or new programs that may need to be implemented? So that's what this course deals with. Next slide. And then I talked already about the introduction to the life sciences for those going into medical school or dentistry or other with higher basic science requirements. And there basically we're doing the introduction to basic language, the basic principles and content in basic pre-med sciences, and preparing you for the MCATs. This is a year-long course for those in that track. Next slide, please. And as I mentioned, in the second track for those going into employment, will be a course, the first semester course on nutrition and health, which is the relationship between lifestyle and socioeconomic conditions and nutrition, health, and well-being. A great deal of work being done in that area, and we happen to have perhaps the world's expert on microbiomes and nutrition in our group, Dr. Levitin. She laughs when I say that. She is an expert in that arena and has served as our guru for all of us as we've tried to be healthier. Precision Health and Community Medicine is the second semester course, and that's basically what is coming, what the future holds for this effort to intervene in communities and with families and individuals away from the medical care system. What are the new science, the new computational tools, the new decision support tools like artificial intelligence and machine learning? What are the kinds of technologies that can help us bring things more effectively to communities that improve their health and lower the burdens of illness? Next slide, please. Then let me just briefly touch on the capstone experience, and then we'll be done and we can answer your questions. The first year capstone experience, as I said, takes place in the community. You will each have you will identify a community site where you will work for 2 years while you're in the program. And we will help you identify one. If you have problems, we want to approve it, obviously, before we'll accept it as a place for you to go. But basically what we're looking for is anything from a federally qualified health system to a community clinic to a local organization that's dealing with food deserts or with early childhood education, all the things that have to do with and so heavily influence health outcomes in a population, in a community. So what we want you to do is to use that as the doorway into your community and then build a story about what is the healthcare of your community. Gain the trust, collect the stories, find, interpret, and summarize the relevant data, and then put it together into a coherent picture that describes your community. That's your first year project. And you'll spend a lot of time talking with people in the community, in their homes, gathering information, listening to their stories, learning how to get their stories, learn their stories, learning how to build trust with them, learning how to listen behind the words to hear the real meaning behind those words so that you can gather their stories and then incorporate it with objective data to build a coherent, data-based, analytically sound story about what's going on in that community. Next, please. And then the second year, you pick an intervention based on the health problems of that community, based on where there may be an opportunity to intervene. And we want you to think about an intervention that is upstream from a particular healthcare problem. So instead of intervening in diabetes, for example, we would say, why don't you intervene in nutrition or in exercise or in stress management or something of that nature, upstream in the lifestyle/social determinants of health area that has so much influence on illness. And we want you to choose the intervention, build the community support, design and implement the intervention, and create and maintain the momentum for getting it done, stay on track, evaluate the impact, and then sum it up. And here we've got some fun. The summing up is not a thesis necessarily, unless you want to do that. But it can also be a photo essay. It can also be a series of artwork. It can be a play. It can be a piece of music. It can be a short story. It can be any kind of creative way that you can tell a story about what you tried to do and what the reaction of the community was and the impact you had. So what we're really teaching you is about the process of communications that is so central to becoming effective, either as a doctor when you're talking to patients, or in this role as an advanced community medicine clinician, where your main part of your job is learning how to build bridges into communities. Now, let's just close by saying this. Think about how much we have to do to get people to take the vaccine or to wear masks in this epidemic or this pandemic. Think about the challenges that we have in different communities because of trust, because of other experiences upstream, because of the lack of people who are telling them the stories that they trust. If I come into a community that's a Latino community, for example, or to an African American community, I'm not going to have the same trust that someone from that community will have when I say you should be wearing masks and explain why. It's just the nature of it is human nature, and especially true now where distrust levels are variable, but often very high. So the role of being an advanced community medicine specialist is being able to build those bridges through effective and empathetic communication. And we spend a great deal of time on those skills in addition to the knowledge base and skill base that you need to have to bring the science and the advances in telecommunications, in analytics, et cetera, to bear on the very significant problems that we have in the communities around the country, and especially in the underserved and underrepresented communities. Now, let me close by saying that to date, we are planning our first class in the fall of this year. It is a small class because we'll be testing the curriculum. The curriculum is brand new. It doesn't exist anywhere. We're making it up we're creating, I guess creating is a better term than making it up. We're creating it sort of out of whole cloth. It's, grabbing pieces and ideas from various places, but we're putting together a curriculum that we think is the right curriculum for this job, for this work that needs to happen. Interestingly enough, all the synchronous courses, not the capstone, but all the synchronous courses take place online in an active learning environment. So you're not required to come to the campus. It won't be in classrooms. It'll be in a very special form of teaching that we are developing in consultation with the DeepHealth help of probably the nation's leader in online active learning, Stephen Kosslyn. And Dr. Kosslyn is helping us craft the curriculum. And let me give you an example. The longest lecture we have in 2 years is 12 minutes. Now that's kind of a change from maybe the way you've been taught. It's a complete flip-flop in the way we're doing the teaching. And it turns out it's a much better way to learn for the students. It's not as easy for the faculty. It's very good to stand up there with your yellow pad and give a lecture that you gave last year and the year before with little modifications, not have to think a lot about it. But you don't learn very much if you're sitting on the other side listening to it. It's hard to remember. And what we've developed is a curriculum that is based on the most recent and most effective science of learning, and that is active learning, and that's what Dr. Kosslyn is helping us do. So much of the classroom didactic work, or the foundational courses, the 2 tracks that we talked about, will be taught in synchronous classes. You'll be in classes with your classmates, but you'll be doing a lot of the work in the active learning environment. In the capstone, you'll have some of that and also be out in the community doing the work that I described in the capstone projects. So that's it. It's very exciting. We think it's going to prepare you very well for either medicine or another advanced career in healthcare, or to go into employment. 14 medical schools agree. Their deans have joined our Council of Medical School Deans because they want to help us make sure that the curriculum prepares students in this program for medicine. They want to get to know you. And a few have said, when we get to know you and watch you in this program, we will get you to jump the queue so you can come right in for interviews. And a couple have said, look, this is how we want our physicians trained in the future. We want them to have this background and basis in community medicine. That's going to be the future of primary care, along with clinical practice. So we will accept those successful graduates directly into our medical school. Now, those are things they're saying. We don't have those things guaranteed, and I don't want to pretend that they are for sure, but we have assurances from several of the deans of the 14 that will be the case. The medical schools include several from California, Stanford, UC Riverside, Cal University Science and Medicine, Charles Drew, I have invitations from UCS to UCSD. I'm meeting next week or in a couple of weeks with UC Davis, and actually Wednesday with UC San Diego. We also have the University of Oregon, University of Kansas, Texas Christian University. We have a new medical school in Las Vegas called Roseman Medical School. And we have the other two HBCU medical schools, Meharry and Howard. We have a medical school in Pennsylvania associated with the Geisinger Medical School. It's one of the most innovative healthcare delivery systems in the country. It's similar to Kaiser Permanente. It's smaller, more regional. They have a wonderful new medical school there that's about 4 or 5 years old. Boston University, NYU, Long Island. And I think that's it for now. But it's a very good group of deans and very engaged. Hackensack Meridian in New Jersey was associated with Seton Hall and now is a standalone, led by a wonderful dean named Bonnie Stanton, who's a pediatrician from Yale, and really doing some very innovative things in medical education. So we're very excited about that, and we're working with a group of employers from the safety net systems to make sure that this curriculum prepares students who want to go into employment for jobs that are important and jobs that exist. And we have some ways that we're tying the loop between the employers and our graduates to facilitate employment after you finish the program, if that's the direction you want to go in. I've talked too much. This is it. Let's take your questions.
Thank you, Dr. Lawrence. And now we're going to have Anel Farias, one of your staff, monitor the chat.
Okay, and then if people have questions in the meantime, how do you want to do that? Do you want to do it all by chat, or Mariela, or do you want to do it with questions as well?
So we could probably ask maybe some of the questions that were asked in the chat first.
Okay, let's do that.
So I think the first question, thank you so much for entering your questions. Go ahead, Anel.
So I think the first one I see here is, how is this program different from an
MPH? You cut off a little bit.
Oh, from an MPH, how is it different?
Well, an MPH is a good academic degree. It's the one I have and I taught in, but it is not a hands-on skill-based degree. It doesn't teach you to be a clinician in community medicine. It teaches you to be, it's an academic degree. It teaches you about public health, teaches you about aspects of public health, but it is not, an MPH is not intended to make you into a clinician who's ready to go to work in the community. So they're very different degrees. We looked at making this an MPH degree and decided against it because we wanted to train people who are going to be practitioners of community medicine. And there's a whole set of sciences and a whole set of skills for that you don't get in an MPH program.
And this next question might be for Dean Toro. What type of financial aid is offered for this program?
Hi, everyone. I'm Dean Toro, Dean of Admissions and Financial Aid. Welcome. And thank you for your interest in our program. So we have 20 seats available in the first cohort. And we have full scholarships for those 20 students for the first year and second year. There are also other resources available through financial aid where you can take out additional loans for up to cost of attendance or any other budgeted items. So our financial aid team will be working with everyone as you get into, the process of application. We'll then review your application. The admissions committee will do a holistic review of everything in your file. And then it'll go directly to financial aid where they can help you with any additional loans that you might have to take out outside of tuition.
And Dr. Toro, let me just add one thing. The reason that the first class is full scholarship, fully subsidized, is that you are our partners in refining the curriculum. And so we'll be asking you to give us a great deal of feedback, hopefully constructive, about the curriculum. And that's why we're setting this up as a fully subsidized first cohort coming through our 2-year program. We're now trying to raise additional funds. We have some funds. I don't mean that we don't have any, but additional funds for a substantial endowment so that we can continue to reduce any financial burdens that this might bring for people who are applying. Again, we know that that's a significant barrier for you, especially if you're coming from an underserved and underrepresented community and may have some substantial financial constraints to be able to go on at this level in beyond your undergraduate training. So we're trying to minimize the amount of debt that you come out with. We're trying to minimize any of the financial barriers that you might encounter. You know, that's going to be based on what sort of philanthropy we can find, what kinds of money we can raise for our endowment, and also some of the things that are going on politically now with the Biden administration, which look very promising.
Great. The next question, what other services will the program provide for students' career goals?
We might, let me take a crack at that, and then Sophia, you might want to jump in as well. We have really a comprehensive program at KGI for providing student assistance through our Student Affairs Associate Dean, Cindy Martinez. And it's really designed to help you make your decisions. If you get into the program and you decide it's not for you, or even getting help to go to medical school or help to get employment, it's a combination of what is going to be done in student support services and also what we bring and the tools and mentoring that we can help you with from the program ourselves. So we have, I think, a pretty good array of services that we make available to our students at KGI. And remember, we have, I think, the current enrollment is about 700 students with how many master's programs do we have, Anel? Now,
Ooh.
Yeah.
I don't even know off the top, a lot, maybe
We
10.
We
Yes,
have
Sophia, do you-
16 academic programs and 12 summer programs.
Yeah, so it's a very broad, and it's a program, a school or an institute that's been there for 25 years. Next year will be its 25th anniversary. And so it's a well-established program with a lot of support services for students. So this is not, you're not standing out there, and you're part of an institute that has stability. It's part of the Claremont colleges. We probably didn't make that clear at the outset, but it's part of the Claremont College system. It's called the Keck Graduate Institute, and it's a standalone institute with its own master's programs. This program, by the way, is accredited by WASC, the accrediting body for master's level programs in the West. So we've already gone through that hoop.
And we also, thank you, Dean Lawrence. We also have additional resources through the consortium. So the Claremont Colleges is 7 universities where we have 5 undergraduate, Pomona College, Pitzer College, Claremont McKenna, Scripps, and Harvey Mudd. Those are 5 undergraduate institutions plus the 2, Claremont Graduate University and Keck Graduate Institute. We all share resources. So we all pay into the consortium, so all of our students have resources like the library. We have mental health support and counseling services. We have a disability resource center. We have affinity groups, intramural sports. So just really depending on what you'd like that graduate school experience to be. On top of that, we have resources at KGI. Dean Lawrence mentioned student affairs. There are over 35 student clubs on campus, all graduate school type experiences. And we also have student government, who you can run, to be on student government. You could be a part of the different events. We put on different fairs, a lot of career development. So our career resources are phenomenal. We have great outcomes for a lot of our programs. You have to ask, different institutions, well, what's your placement rate? So our traction with this new program is really going to help you based on what we've already done and established for KGI. So I think taking that into your hands and saying, okay, how can I continue to develop and grow? I also included a couple of links to our webpage for MSCM, but also for summer programs. How else can you expand your knowledge and experience? How can you be more competitive for medical school? So you have to look at opportunities like our summer programs that are free of charge, but at least it helps you grow and develop your resume. So those are a lot of different resources that we provide. And obviously, if MSCM is your top choice and you end up coming here, wonderful. But we also have other pathways to medicine and also summer programs that can continue to help you explore and gain experience.
We do have a post-baccalaureate program that's quite popular. And it is the more traditional post-bac program. It's a certificate program. It provides exposure to some basic sciences to help you raise your GPA. It does have some opportunities to work in getting your MCAT scores up. And it does have career counseling to help you with your application process. And we'll be drawing on those same capabilities in the Masters of Science in Community Medicine. So again, I think what Dean Toro just mentioned is important. This is not a standalone effort. This is part of a larger institution that has a long track record and substantial resources.
Exactly. And we have career services as well with an extensive network of various companies and places. We also prepare students for employment. We do help them with resume, we'll help them to prepare for interview and so forth. And I can see one of KGI alums is here, Sergio. Hi, Sergio. Okay.
Thanks, Anastasia. What are you want to do the next one, Anel?
Great. And next question, how do you choose the community you want to work with? Is there a list KGI provides?
Could you say that again? I'm sorry, you're breaking up a little bit, Anel. It may be my internet. Could you try it again?
Oh, I'm sorry. Can you hear me? Yeah. How do you choose the community you want to work with? Is there a list KGI provides?
No. The first step is for you
Can you
to.
hear me now?
What?
Oh.
Yeah, I heard you. The first.
Oh, no, sorry, I thought you couldn't hear. Okay.
Yeah, I heard. I just turned off my video so I can get a little more bandwidth here. Where I live is fairly rural, and so it's sometimes a little bit problematic.
It's not you, David. It's all of us. I think it's Anel.
Okay, good. Okay, thank you. What we ask you to do is identify a place in your community that will work for you, and we'll help you, talk it through if you have questions about it and so on. If you identify something, then we'll want to go out and meet with the mentor, the person that is going to help you get access to the community from that place. And we'll help them understand what the expectations are and what we'd like to have back from them as they're helping you do what you need to do. So that's the usual route. Now, let's say you have trouble or you don't know any of the community resources where you're living and studying. We can do some work with you to identify some possibilities and help you make some calls and see what we can set up. If push comes to shove and we can't make that work, then we're going to have a library of options for you to use for your community sites. But again, the optimum thing is for you to be able to be in a community site that's where you are studying. We want you to be able to go, say, 4 days a week. In the first year, 4 days a week, you'll be in our didactic program in our synchronous classes, in the foundation courses and the tracks. But the fifth day of the week, Fridays usually, you'll be all day in the capstone. You'll be all day in your community. We don't want you to have to travel. We want you to be able to do it where you live and where you're studying. Second year, you're going to be in the capstone probably 3 days a week. So the best solution of all is something that you and we can, and we'll help you, but something that you can find and identify in your community. And we have a few criteria for what we're looking for, but they're very broad because really, go back to what I said earlier, what we're looking for is a community site that offers you a doorway into the community, has credibility in the community. And because of that credibility, regardless of whether they're a social service agency or a medical agency, a healthcare agency, because of that credibility, if they introduce you, you will have some of their credibility that rubs off on you and helps you do the work that you need to do in the community. That's what we're looking for. So I hope I know it's a really big issue for you, but I don't want you to freak out about it. We'll help you as much as we can, and we'll get you something. We'll solve that problem, help you solve that problem.
If you don't mind, I just want to piggyback on that a little bit. I think this is what really sets us aside also from public health. Again, my name is Dr. Monique Williams. I'm the new program director for the Master of Science Community Medicine program. And public health is very broad sweeping, but this is your opportunity to actually go back and pay forward within the community in which you live, the community in which you've grown accustomed to, really be able to recognize the diversity within specific communities, just as much as it is between different communities. So think about even your own family's healthcare provider, some of the resource centers that maybe your family members have used, and how you want to give back and learn more about how to support those systems. So I think it's really important that you really try to identify those things that are close to your heart, things that are connected to you and your family and your community, and that really fuels your passion to move into this area of medicine. So just as Dr. Lawrence mentioned, I think it's really important to not only identify it for the sake of getting through the program, but also really to contribute and to feel connected to the community in which you want to serve.
It's really, thank you, Dr. Williams. That's really important, really, really important. Because one of the things, I mean, I'll just express a little bit of philosophy here about our program. One of the critical things about working in communities as a student is how often people in those communities feel like they just got jobbed. You come out, you go to the community, and then you leave. And the community's left saying, what happened? Just something, you know, we had somebody here for a few weeks and they're gone. So this idea of going into your community and moving where your passion is, working over, and think about it as a 2-year opportunity to be associated and give back to your community. And hopefully what'll happen is what you leave behind will be enduring and you will want to come back and continue it. And that's how you build trust in a community with what it is you're trying to do. You're there for the long run, and not just some fly-by-night person who comes in, drops a lot of nice ideas and then leaves. No wonder there's distrust. That's happened over and over again. Thank you, Dr. Williams. A really important point.
Okay, can you hear me now? Better?
Yeah.
Okay.
Yeah.
The next question, is a hybrid including both track 1 and 2 available for the program?
Not yet. It's not both, but and I know that's a problem because I'd like to teach it. I'd like to teach both to everybody, but right now the big issue, the big barrier to getting into medical school still, unfortunately, is the basic sciences and the MCAT test. And so we want to make sure that the students who are going to medical school are not kept out of medical school after going through our community medicine training because they lack those credentials for some medical schools. Everything's changing. It's fluid now, and the requirements are changing. Some are dropping them entirely. Some are even talking about doing away with the MCATs, but not yet. And it turns out that most medical schools still require that you do something that you perform adequately on the MCATs. We don't want our students to be in any way handicapped. So we're going to ask the medical student aspirants who haven't already done well on the MCATs or haven't already gotten their basic sciences to come through the life sciences program. But to do that, we've got to have another track for those who are not going through that path. And unfortunately, we can't mix them to unless you're a superstar and you can manage all the credits that would require. But I don't think it's going to work because we're going to do them contiguously. They're going to be taught at the same time.
Is there a specific number of applicants for each track?
No.
And is this program conducive for working adults?
It's hard to do work during this first cohort going through the program. However, in January, we're going to introduce a second program, which will be the same program, but a second class, which will be taught in the evenings and specifically for people who need to work. And we anticipate going forward that we're going to continue doing that, a combination of full-time student program and a working student program, and run them at separate times of the year. But we have a great deal of interest from people. For example, when we announced this opportunity to the LA County Health Department, we had several people call and ask if they could continue working and get this program. We can't in this first cohort. We think it's going to be fairly demanding, but we're going to adjust it and play with it a little bit and make sure that we do it for working people in the second cohort coming in January. That's our timing that we're hoping for now.
Great. And how will KGI support students if the curriculum does not succeed after the first cohort?
how will they support students if it doesn't succeed? Well, it's going to succeed. I mean, I'm not even considering that. And the reason is, again, the demand for the program is substantial. I mentioned that we have over 300 applicants now that are in flight, that are in process, and somewhere around 50 plus that have already completed their applications. So there's substantial demand. We're working with employers and we're working with medical schools. And so far, everybody is saying absolutely central to what needs to happen in U.S. healthcare. So, you know, the big issue for us is not making it self-sustainable. We have enough funding to do that. We have about $13 million now that we've raised for this program. So we have sufficient money for getting it to self-sustaining. What's really important, though, is getting the endowment program in place so that we can provide much more financial aid going forward. We're doing it for the first class, as we said, but we want to continue that in the subsequent classes as much as possible.
For students who decide to follow track 1 of the MSCM program, could you elaborate on the content in basic pre-med sciences? Is this track more focused on students who have some background education in the prereq sciences necessary for medical school?
Well, first, it does not focus on students who have prereqs. It makes the assumption that you don't. If you do, you'll be somewhat advantaged in parts of the program. But basically, we're constructing it, and Dr. Levitin is the person who's really leading the construction of this track. Dr. Levitin, do you want to add in a little bit and describe or answer that question?
Yes. So this MCAT or pre-med track for students who are interested in going to medical school or continuing to health education, we will follow the one of those MCAT prep idea of MCAT prep courses like Kaplan or Princeton Review, where we start with a first test where we let students take a test and see how they do, so we can identify weaknesses and strengths of each student, and then we'll work on filling those gaps. And we will be students will be taking tests on different parts of the MCAT or different parts of the on the MCAT course to see how they're progressing, whether they're getting better, what we should work on. So it will be personalized approach, and at the end, students will do a number of full-length MCAT classes to make sure students are prepared for the MCAT. But this track will be more than MCAT. We want to introduce to people who don't have the background, basic sciences. We want to fill that gap and educate them, make sure that they have what is needed. I hope I answered.
Let me just add to what Dr. Levitin mentioned. We're there. The MCATs really cover 3 or 4 areas of the basic sciences, which are really the pre-med basic sciences: biology, chemistry, behavioral science, and creative thinking are the 4 areas that are typically covered. I think that's right, isn't it? I don't think there's one other. And what we're doing in this program, in this course, is really covering the first 3, the biology, chemistry, and the basic and behavioral sciences. That's how we're organizing this. But more importantly than that, we're collaborating with one of the medical schools that is in our Dean's Council, the NYU Long Island Medical School. And what's interesting about that medical school is that it is the only standalone 3-year medical school in the United States. It's accredited. It's a very good medical school associated with the NYU system. But they've organized the curriculum so that it's delivered in 3, not 4 years, which means the first year is a tightly integrated program that includes the basic sciences and introduction to clinical sciences, the clinical skills you need as a clinician going through medical school. We are collaborating with them to see how they have actually integrated the basic sciences throughout that year-long curriculum. And they do it through problem-based learning, it's called, which many medical schools are now doing, by the way. So the way we plan to teach those basic sciences that Dr. Levitin just mentioned is really using a problem-based approach that's adapted from that medical school curriculum, because that's what you're going to run into in medical school. And so we want you to learn how they are introducing the thinking that goes on in being a clinician in medical school, et cetera, and learn the basic sciences in the process. So this will not be a didactic course in microbiology. God help us if it is, even though Dr. Levitin would love to teach that and does it. It's not a basic course in organic chemistry. It's really a problem-oriented kind of program that introduces you to biology and chemistry and behavioral science. And it's built around real world issues that people have in the communities and have in their clinical lives. So that's how we're going about it. I don't know if that answers your question, but again, we're making this up as we go along and drawing from a lot of different resources. And thankfully, Dr. Levitin has been doing this in her areas of expertise with students in the post-bac program and in other master's programs at KGI. And we have a rich faculty at KGI that we're drawing on for subject matter expertise.
Given that many of us have an interest in pursuing medical school, would you advise that students wait to apply for medical school once they are admitted into the program? In other words, would students be able to apply for medical school while in the program?
Yes, you can. That's exactly, in fact, most of you will. We don't have guarantees yet that say, if you come through our program, you're going to get into medical school. We've had three people say a couple of the deans say that's what they would like to do as they get more comfort with our curriculum and know our students better. But for now, the transition is going to be, you come into our program, you take the first year medical school track if you're in that particular cohort, you take the MCATs as soon as you can after that's finished, and then you apply for medical school. And that would be for admission after you graduate from our program. So basically, if you're going from our program, which is a 2-year MSCM program, master's program, and then you do your 4-year medical school, then you come out with an MSCM and an MD. If you go to the NYU medical school, it's a 2-3 arrangement. And by the way, our own medical school, which we're not developing at this point, we put it up, not on hold, but we're continuing to work on it and developing the financing for it, will also be a 3-year medical school, like the one in Long Island.
And I can take this next question. For DACA applicants, what should we enter for our visa type? So when you're applying, you should have an area where it says other visa type, and then you could go ahead and type it in and just go ahead and enter DACA. I'm gonna also put my personal email address in the chat group. So if you have any questions, or if you've already started an application and you didn't indicate that you were DACA, you could just send me an email and I'll take care of it on my end.
And you might also mention our policy with regards to undocumented and also international students.
Yes. So for international students that require an F1 visa, student visa, we are unable to provide that for this program because the MSCM program is entirely online. So we're not able to offer a student visa for the program. However, if you are a DACA student, you can definitely apply. We welcome your application and encourage you to complete the process.
And if you're undocumented, but I don't know what the distinction is legally, the distinction, if you're undocumented, not in DACA, we're indifferent to that. That doesn't matter. So if you're here and undocumented, but want to apply, we welcome you.
Thank you. The next question, how will you select 20 students for the first cohort?
With great difficulty. I don't know, especially when you have 300 candidates or over 300 people who are applying. What we're trying to do is, obviously, we want people who we think are going to be good partners with us in helping build the curriculum and refine the curriculum. But we're looking, the kinds of characteristics. Somebody asked me a few meetings ago in another group, what would you define as the ideal candidate for this program? Well, honestly, we don't know yet, but I can tell you the sorts of things that Dr. Williams and Dr. Levitin and I are looking for, and Dr. Toro and all of us who are involved in the admissions process. First of all, I'm looking for somebody who is infinitely curious. I want somebody who is curious about how things work, how people live. I'm interested in people who have emotional intelligence, who understand how to work with people from different backgrounds, from different groups, different emotional valences, if you will. I want people who are comfortable with ambiguity and have dealt with ambiguity in their lives, uncertainty in their lives, have had to navigate their way through, ups and downs that we all go through. And you can demonstrate that you know how to do that effectively. And let me tell you why all of that is important. Obviously, your intelligence will try to measure in interviews and see how you did in school and with your references. We'll try to get a sense of how dedicated you are and what kind of a student you are. All of those things are important, of course. But at the end of the day, what we keep coming back to is when you get into a community as a community medicine specialist, you're undertaking one of the most difficult jobs that there is in healthcare, because communities are complex places and very difficult to work in, even if you come from them. You've got a lot to learn, a lot of opportunities to understand all the nuances in a community that you may not have been aware of if you grew up there. So what we're looking for is trying to come up with the people who are going to be most effective in these settings, whether or not you're going to go do it as a physician or as an advanced community medicine clinician in employment, directly in employment. We don't care. For this program, it's the same characteristics. Interestingly enough, when we describe our program, and this I'll refer to the woman I mentioned at Hackensack Medical School in New Jersey, associated with Seton Hall, the pediatrician, Bonnie Stanton. When she saw our curriculum and she heard about the students that we were going to be admitting into our program, she said, I want those students in my medical school. Those are exactly the kinds of students who are going to be outstanding community-facing physicians once they finish medical school and their residencies. I want them. That's where we hope we will get this program to be. And we're also selecting students who will be great representatives of this program, who will be great ambassadors.
Great. The next question, how is this program recruiting CSU graduates? How will they be prioritized?
I'm sorry, say it again.
How is this program recruiting Cal State University graduates, and how will they be prioritized?
We're doing it by going out to the advisors in the various campuses. We've made announcements to the entire system, to the healthcare advisors. We're working through the presidents of the various campuses. They form an executive committee for this program in our collaboration with the CSUs. And we've been working with the president's or the chancellor's office for the entire system. It was Dr. White and Dr. Blanchard. As you know, Dr. Blanchard's leaving and going to the University of Houston as president. We're working with the transition administration now. So we're doing it that way. And we're getting it out as much as we can to as many of the campuses as are interested. We also have a work group, which is made up of presidents of Cal State Long Beach and Cal State Stanislaus. And they are working with our team to put the on-the-ground program for the pipeline in the CSU system. The same is going on at Laverne. I will say that we are looking for students from CSU system. We're also looking for students from Laverne. I don't think it's fair quite yet to say we're prioritizing any students, because we're still looking for the best who are going to be in that first cohort of 20. As we get further into this program, I suspect that we'll be able to make a statement that says, yes, we prioritize CSU students. They're the number one group we want to do it with, to have come into our program. That may be the case, maybe not, I'm not sure. But right now it's premature to say that. We are working very closely with a CSU student, and I really want students from CSU. And also, we've had some excellent candidates from the University of Laverne, where Dr. Williams was before she came to our program. So we're being very agnostic about this. We're looking for character and capabilities as much as we are which program you came out of.
If a student applies to this program with an MCAT score, are they disadvantaged in any way when being evaluated for acceptance?
No.
Will the working student program in January also be full scholarship?
No, we don't know yet. It depends on whether or not we can raise the funds for that. But at present, the best answer is to say, I sure as heck hope so, but I have no guarantee that that's the case yet. Again, remember, this is we're a brand new program. We were fortunate to get a $5 million grant from LA Care to provide scholarships. We were fortunate to have a gift to the program from a friend of KGI's. So we raised the money to be able to do it for the first class. And that's the job that I'm doing now, while Dr. Williams and Dr. Levitin do the heavy lifting in terms of building the curriculum, and all the other, and Dr. Toro and all the team in admissions are doing all the heavy lifting of actually putting the course together, the program together.
I know you stated you would try offering evening classes for those who work. Do you believe a full-time employee can successfully concurrently participate in this course, or would you recommend perhaps decreasing to part-time employment?
I think that's going to be very individualized. I think it really depends on how much you think you're capable, what other kinds of demands you have on your time. If you're, example, a couple of people who are applying are in their late 20s, early 30s. They may be single moms or single dads. They may have family obligations on top of going to school and working. And so each person is going to have to make a judgment. We'll help you with that. We're here to help you with that and make that judgment with you. But I don't think there's any formula that says you can or can't.
And I have a student asking, just confirming that if they're interested in medical school, if the first track would be the best fit, and if it really doesn't matter if they don't have any pre-med courses.
It would be the best. In fact, the only fit if you're going to go to medical school and don't have all those prerequisites handled already, and you don't have an MCAT score that you're proud of, and you want to raise it, then come through the medical track. That's going to be a really good track, and I think it's going to do an awfully good job of preparing you for medical school and make you very competitive for medical school.
Okay, and this will be the last question. Again, I did type in my email address, so please feel free to send me an email if you have any questions. If I believe Dr. Lawrence or Dr. Williams will better answer the question, I will go ahead and forward the email to them.
And if it's about the microbiome, Dr. Levitin will answer the question. I'm teasing her. She loves to talk about that. So.
So the last question, is the program offering any application fee waivers, and specifically the $75 fee? So yes, we can definitely offer you an application fee waiver. I'll type in my email address one more time in the chat. Please go ahead and contact me directly, and I'll give you a code that you can use.
Are we there, Anel? I think probably that's enough for tonight. Is that right? And then we'll get questions and emails if we can answer further questions. We're all available to answer those questions and happy to do it. This is terrific. Your questions are right on point, and I hope we've answered some of them anyway. I know there are probably hundreds more, but don't hesitate. Don't hesitate to send us a note, and we'll do our best to respond as quickly as we can. Again, I want to say that this is a program that's directed, and it will be exclusively directed at kids who come from underserved and underrepresented communities. We're not interested in admitting kids who come out of were raised in privilege, whatever its origin. We want those of you who know what it's like to live and be and grow up in those communities, because we believe that you will be the best people to go back to those communities eventually if you choose to, and can bring a level of trust and bring a level of engagement that is not possible for other people. It just doesn't work. And so that's why we're focused where we are, and we're really absolutely committed to this. Our board of governors that we've created to oversee the program is committed to this mission and represents the kind of diversity that we hope to have in our own student body. If you look at the people who are on the board of governors, you'll see people who look like you and come from backgrounds that are not dissimilar. And we've done that absolutely on purpose. The same with the faculty. As we put together our faculty and provide mentors and provide the kind of oversight Dr. Williams and Dr. Levitin and the other people who will be involved in this on a day in, day out basis with you, will provide mentorship and hopefully support you in that kind of career development that you're undertaking with us.
Thank you so much to all of you. This was a very engaging, informative session. I did wanted to share, I did share the link to the post survey, and we usually always just thank our mentors